Hello everyone, welcome to my channel. I'm Dr. Ritik Dugar and I have completed my MBBS from Grand Government Medical College. And currently I'm pursuing my DNB Medicine residency. So in this video, I would like to talk about how to choose your specialty after MBBS. So the first most important factor for choosing a branch is interest and passion. Like how to choose your interest. So during your final year, in your postings or during your theory classes, you will come across some subjects which you like more over others, or there will be some subjects which you completely dislike. And then when you finally start your internship, try to do it sincerely so that you can have a first-hand experience of work. So when you start doing internship, try to be sincere in those postings which you really like or like. So that will help you to understand it, because whether the practical aspect of it, whether the work going in that branch, do you really like doing that? Do you see yourself doing that 5 years, 10 years, 15 years down the line? For example, in my rural postings, when I was posted in Palghar, we basically had two set of work, like whether to handle the emergency or the OPD part. So I really liked handling OPD, where the patient used to come with their complaints and we used to ask them for various symptoms, analyze different signs, send for investigations, and then probably prescribe some medicines. So I find that really interesting. Emergency, we used to do minor procedures such as suturing, dressing, and I did not like doing that. The people were really excited when they got the opportunity to do suturing, but I personally, I did not find any interest in that. So by the end of internship, you will definitely be able to figure out whether you want a medical branch or a surgical branch. So medical branches include like radiology, dermatology, medicine, pediatrics, psychiatry. So I was basically interested in three branches like medicine, pediatrics, and psychiatry. To think about second most important factor is longevity. No, you need to be very aware while choosing a branch that whichever branch you are choosing, it's going to stay with you for the rest of your life. So I was interested in psychiatry, but I did not see myself doing this even 10 years later down the line. So yeah, I really liked psychiatry and I still do, but I knew like I can't do this job day in and day out for rest of my life because I'm a very emotionally sensitive person. While considering longevity, metaphorically it's like whether the attraction towards that branch is an infatuation or love. So third most important factor is money. Like our relatives say एक बार डॉक्टर बन गए तो फिर पैसा ही पैसा है. So it does not work like that. But so I don't think so branch makes you money. Like if that was the case, then people in some particular branch will have very good amount of money and all of them will have very good money. And if that some branch does not make you money, then all of them will not have money. But it does not work like that. So it is up to you how you make money out of some branch, because some people have made really good amount of money in paraclinical branch, while some do not chase that money even if they have a top-notch clinical branch. So it totally depends upon you. But what I do personally think is that like if you do what you love, like money will eventually follow. Like for example, even if I take radiology, like I don't understand radiology at all because it's very difficult for me. Like I cannot comprehend different MRIs, CT scan, USG. So even if I take radiology, I don't think so I'll be good at it. I don't think so I'll probably be that successful. So fourth very important aspect is rank. And I personally think with a good rank comes the freedom to choose any branch you like. But it does not necessarily mean that if you have a good rank, you have to take a certain branch. Like you might be having a good rank, but you still may not want radiology or dermat or medicine just because they are preferred at a higher rank. So what if you don't have a good rank for your desired branch? Then comes three situations: whether it was your first attempt with your internship, whether it was your drop attempt, whether it was your attempt in which you have given your 100% and you know like this is the best I can do. Then what you first attempt with internship and you're not getting your desired branch, then I definitely think that you should take a year to prepare, because internship in itself is a very hectic process. So if it was your drop year, so ask yourself like where do you stand? Like you might be done with the studies, like you might be saturated with covering syllabus again and again, or you might have not given your best even in your drop year. So what should you do? So if you are saturated, then try thinking other options also. Because let's say if you are in a medical branch, you might not get medicine, but you can get other medical branches or other choices which are available to us, and compare the pros and cons of those branch and decide for yourself. Question is, like, even if this was your drop attempt, but you did not take the drop attempt seriously, you are feeling like you could have done better, or you are very confused, like should I take drop again or not. You do need to talk to those people who have taken a drop again, or who did not take, and what is their perception or what they think retrospectively, whether they regret it or whether they are grateful for taking another chance. So that is your personal decision. So talk to those people who have been in that same scenario and then moved forward in their career, so what they have to say. Now the fifth most important is final decision. Like, even after my NEET results, I was very confused, like whether I should take medicine or pediatrics. So you have to do the detailed comparison and then decide for yourself. For example, in medicine, DM is necessary, while pediatrics is still an end branch. So DM is optional. So if you want not to pursue further education, then this factor is very important in deciding the branch. For example, I really want to pursue further education. So DM is necessary was not a hurdle for me. Like, dealing with patients was much easier in medicine. Though I like children, but dealing with neonates was extremely difficult for me. Or if you are someone who completely do not like dealing with children, so then pediatrics is not for you. So majority of cases deal with history taking and diagnosis, which is my primary interest. But here in pediatrics, as per my experience in my postings and internship, I realized majority of cases deal with symptomatic management, be it dehydration, fever, malnutrition. So that way, I found medicine more academically challenging. So another benefit of medicine is it deals with the wider age group. Like, even children comes to general physician, while pediatricians deal with restricted age group. Though they do have enough patient load, because when it comes to children, people are really sensitive, and we do seek physician recommendation very for even a minor ailment like cough and cold.